Take a moment to appreciate this waveform. You see a flat baseline, a sharp vertical rise, a smooth plateau, and a clear peak before it drops back to zero. Everything is consistent and evenly spaced. This is the normal capnography waveform, the pattern of healthy ventilation, perfusion, and metabolism working in harmony. You should always anchor your interpretation to this shape. Any change in slope, height, or contour reflects a physiologic change, and in the next slides, you'll start to recognize exactly why. Thanks for watching. If you found this helpful, go ahead and like the video and subscribe to the channel so you don't miss the next one. And if you want the full masterclass, along with tons of other high-yield medical education, visit academy.emergeprep.org. And I'll see you in the next lesson.